Welcome back in the another video discussion of extrapulmonary tuberculosis, Indian guidelines. We will discuss about the guidelines for extrapulmonary tuberculosis management in our Indian setting. So, our Government of India or ICMR has established guidelines for the management of extrapulmonary tuberculosis. So, first we will start to understand what are the basics, foundation of tuberculosis treatment, extrapulmonary tuberculosis treatment, and then in the subsequent videos we will discuss one system, one by one, diagnosis, management, and the guidelines of extrapulmonary tuberculosis. So today we will discuss about some 10 basic principles that are applied when you treat a patient of tuberculosis. So welcome back. I am Dr. Kumar Sharma, Assistant Professor, Department of Respiratory Medicine, working currently at GMC Haldwani. So let's start, and we should try to understand the principles. So what are the principles? These are the 10 very basic principles about what every EPTB patient in India needs. A basic standard of care means, or every patient of tuberculosis, patient have some, we should follow some basic principles when we start treating such patient, and every patient of tuberculosis should be treated keeping this very basic 10 principles under consideration. So whenever we are treating a patient of tuberculosis, we should keep these 10 basic principles in our mind so that we can treat them effectively. So what is principle number one? Principle number one, that is your patient first. So first we should keep the patient as a priority, and in that situation we should adopt a patient-centered approach to manage EPTB, to promote a well-being and adherence to the treatment and to relieve suffering. So our target should be, we have to treat the patient of extrapulmonary tuberculosis to promote their health, and we have to also make sure that they are adherent to their treatment. By that, if we do so, we can relieve their suffering. Okay, and also we should tell the patient that patient have the right to be fully informed about their care at every stage, to be able to make decisions about their treatment and to be treated with dignity and respect. So we should also discuss about the disease and how we are going to treat them and what are the outcome. Okay, so that is a principle number one. Coming to principle number two is promoting early diagnosis. We should try to promote early diagnosis. If we suspect any patient that this patient might be having tuberculosis, so we should take minimum time and we should do the appropriate test to diagnose this patient early. For example, why this is important? Because if the patient is having lung lesion to a particular one lung, and if we delay in the diagnosis, the chances that the second lung, another lung will also be involved, and disease will progress. So we should always promote early diagnosis to treat early and to save the patient, and so to save the parenchyma. Principle number three is we should assess a tissue-based diagnosis. What does it mean? Tissue-based diagnosis means when you diagnose a case of tuberculosis, one is your clinical diagnosis, second is your microbiological diagnosis, and third is your tissue diagnosis in the form of FNSC or a histopathology. We know that we can see the granuloma on histopathology or FNSC. Right? So remember always that tissue diagnosis and microbiological diagnosis of tuberculosis is always superior than clinical diagnosis. Nowadays, we have ample of investigations available. We have resources are there that we can establish a diagnosis of tuberculosis either microbiologically or a tissue diagnosis. So always you should try to establish a tissue diagnosis or a microbiological diagnosis to confirm the disease status. So that is principle number three. Principle number four is very, very important. We should always address a drug resistance, because we know that MDR cases are increasing, and treatment of the MDR TB is entirely different from your drug sensitive TB cases. So all patients with a diagnosis of EPTB should be risk assessed for the drug resistance prior to starting the treatment, and drug susceptibility testing should be available for all patients at the risk of drug resistant tuberculosis. So you should always check that the patient is drug sensitive case or a drug resistance. Okay, and that should be done beforehand to the start of treatment. Reason number five, that we should avoid unnecessary invasive and costly tests, because invasive test and costly test will have a financial burden on the patient, and also it will delay in the diagnosis sometimes. So we should do a right diagnosis. We should do a right appropriate investigation that will confirm or support our diagnosis. Principle 6 is your access to HIV testing. All patients of tuberculosis must have HIV done, because we know that HIV and tuberculosis are the two brothers, and it is related to each other sometimes. So any patient we should always do at under program also, every tuberculosis patient must be tested for HIV. All right. Reason number 7 is identifying patient with concurrent active pulmonary disease. This is very important to know because these patient may have concurrent pulmonary tuberculosis. So extra-pulmonary tuberculosis cases always get an X-ray done, because sometime in this will help us to know that the patient is having pulmonary disease or not, but also it will let us know that pulmonary focus or a lung focus may be the source from where the bacilli has disseminated to the distant organ. All right. So we should always do a X-ray in such patient. Reason number 8 is we should very ensure that they are getting effective treatment. Means what does mean? All patients should receive an appropriate treatment regime. This is very important. This word is very important. Appropriate treatment regime means every tuberculosis patient must be on the right anti-tubercular drug. About right anti-tubercular drug appropriate treatment regime, I have discussed in detail about our video. You can get the link in the description box or here in the I button. You can read, you can see that video also. So that we should always be very sure that my patient is getting the effective anti-tubercular drug as per weight band and as per the duration provided, and taking all the drugs at a time. So we should always be very double sure that patient is taking effective anti-tubercular regime. Okay. Principle number 9 is very important, that we should promote adherence. Patient should be on the appropriate drugs, but also we have to be ensured that the patient is taking drugs appropriately and is stick to his medication. What happens in the initial days, sometime patient is regular in 1 to 2 months. After that, when they start feeling better, stop taking medicine or they become erratic and irregular in their treatment regime. So we should be very sure, and we should also look for the adherence. Okay. So providers or healthcare should monitor the adherence to the treatment and address the factors that lead to interruption or discontinuation of a treatment. Services should promote retention of patient in care. If the patient is not adherent to his treatment, the chances of failure and relapse are very high in that case. Okay. Issue number 10 is very important. Record keeping and public health promotion means, and we know that tuberculosis is a notifiable disease, so all treatment provided, all tuberculosis patient must be notified government agency under National Tuberculosis Elimination Program under PMDT guidelines, so that our government policies maker can take appropriate decision in the coming future. So this is all for today. Thank you so much for watching. In the next videos, we will discuss treatment of extrapulmonary tuberculosis depending on your system wise. So stay tuned and share this video among your friends and the clinicians who are involved in the tuberculosis care. So stay tuned and keep watching.